If you have a structural injury, then please see your therapist or your physician before doing this program. Low back pain is the most common pain reported in the United States. Let's look at what's going on. Over 55% of your body weight is your upper body. If we were to cut me in half here, 112 pounds would fall straight down. The pelvis, hips, and legs stabilize that weight over midline in neutral posture. So if you're a student athlete that splits their time sitting at a computer and running and lifting at practice, or you're a fitness enthusiast with a desk job, you may benefit from this. Sitting for long periods of time in hip flexion trains the flexors to stay short. Footwear with high heel to toe drop may also be a contributing factor as they lean the body slightly forward, causing a regular postural adjustment of the shoulders over midline. Let's start by looking at the atypical posterior pelvic tilt and kyphosis as the opposite end of the spectrum to see how the spine rounds and the pelvis tips backwards. We will use this to see the subtle change in the anatomical markers on your screen. And now we're looking at the more typical anterior pelvic tilt. So this postural compensation is the result of the muscular adaptation of repeated hip flexion without sufficient recovery. The hip flexors and lumbar spinal extensors shorten. The abs, glutes, and hamstrings stay lengthened and lose strength over time. Besides low back pain, decreased performance in training, practice, or games due to lack of core productivity is another unfortunate side effect we want to avoid. Please take a moment to pinpoint the origin of your pain if at all possible. Experience is a tough teacher because it gives the test before the lesson. So very simple approach. We want to lengthen what is shortened and shorten what is lengthened. First up is the kettlebell flexor smash. We're going to cross our ankles and lay our hip flexor right on the handle of this kettlebell. Now we're going to twist our hips to apply pressure, as much pressure as you can, into the handle. Put the handle slightly more horizontal than your abdominal V. Let's use the foam roller to smash the low back. And we put that roller in our low back with our feet up so the hips stay extended. And if you want, you can put a kettlebell on your abs to make sure you're squeezing your abs this whole time so we get a nice deep smash into the tissue. And allow the roller to effectively apply sufficient pressure on the painful area. Go by feel and work towards intensifying the smash. Now that we've added some range of motion, let's actively stretch with muscular contraction of the opposing muscles. If you have a lying leg curl at your gym that you want to use, or a straight leg kickback, or a standing hamstring curl that you can do this on, feel free. We just want to contract the glute in hip extension. The hamstrings assist in hip extension, so we're going to hit some hamstring curls and actively stretch the rectus femoris. Again, if you have access to a lying leg curl at your gym or you want to do a Nordic raise, please feel free to substitute. The abs are tricky to work in hip extension. I chose the rollouts here, but you can do planks or a standing crunch or curl downs. Remember, we just want to isolate the abs without the thigh coming towards them. We're going to go back to some passive lengthening now that we've got some contraction and some blood flow into the areas. Please make sure that you're stable on this. You're just going to grab and pull on your ankle and stretch the flexor and the rectus femoris. Finally, the Swiss ball prone roll is nice and relaxing stretch where your body weight is supported. I could have done with a couple risers under there to keep my feet up to keep me out of any hip flexion, but you make do with what you got. Please remember to click the subscribe button and check out our website and social media for access to our mobile app, Empowering Movement Project. Move better, play better.